Patients with schizophrenia have lower erythrocyte magnesium levels than controls. Magnesium plays a major role in calming the nervous system due to its ability to block brain M-methyl D-aspartate receptors, or the NMDA, thereby inhibiting excitatory neurotransmission. Magnesium bisglycinate is my recommended source for its high bioavailability and low stomach upset. The best way to determine your magnesium needs is to start with a small dose 3 times a day, then slowly increase it until the side effects of stomach upset and diarrhea are noticed. Once this occurs, slowly reduce your dose until you're taking the maximum daily amount that doesn't give you any stomach discomfort. This protocol can also be used to determine your dose of vitamin C, as ascorbic acid is also useful for schizophrenia. However, there's better forms of vitamin C instead of the ascorbic acid, such as calcium ascorbate, magnesium ascorbate, liposomal vitamin C, and intravenous vitamin C, which could be taken in much larger doses. One trial with vitamin C, it reduced hallucinations, suspiciousness, and disorganized thoughts. Up to 6 grams daily of vitamin C has been reported to be beneficial for people with schizophrenia. In one case, the addition of 400 international units of vitamin E also enhanced this benefit. Inositol is a carbohydrate and is found naturally in your body and in certain foods. It plays major roles in your body, including affecting the levels of neurotransmitters and the way that your body handles glucose. It may be effective in improving some anxiety disorders and your body's sensitivity to insulin. Inositol is a key metabolite in the phosphodiethyl-inositol cycle, which is a second messenger system for serotonin 2 receptors that have been implicated in the pathophysiology of schizophrenia. Evidence from animal and human studies has linked myo-inositol with the pathophysiology and the treatment of psychiatric disorders such as schizophrenia and bipolar disorder. Most side effects occur with doses higher than 12 grams per day. There's good rationale for taurine being beneficial in schizophrenia and psychosis. It's an amino acid and it's abundant in the body. It's neuroprotective against the damage in neural cells caused by abnormal glutamate signaling, which is heavily implicated in psychosis and schizophrenia. A clinical trial conducted in Melbourne in 121 young patients with psychosis found that 4 grams of taurine per day reduced the psychotic symptoms within just 12 weeks. Extracted from green tea, essentially L-theanine crosses the blood-brain barrier, and it has the ability to modulate inhibitory neurotransmitters, selective serotonin and dopamine, to bring about anxiolytic and calming effects. L-theanine can also improve cognition and selective attention, perhaps due to the changes in alpha brainwave activity. Effective doses range from 200 to 800 milligrams per day. Preliminary findings suggest that L-theanine may be an effective adjuvant in the management of psychotic disorders. Patients with schizophrenia or schizoaffective disorder were randomized to receive L-theanine or placebo while continuing their antipsychotic medications. 21 patients who received the L-theanine experienced moderate reductions in the symptoms of psychosis and anxiety, and there were no differences in the quality of life measured between the groups. A GABA dysfunction is thought to lead to the disinhibition of the glutamatergic pyramidal neurons and a loss of synchronous cortical activity. Postmortem studies also suggest that schizophrenia is associated with a dysfunctional GABA signaling at the postsynaptic receptor level. There's speculation as to the availability of GABA supplements, as there are GABA receptors in the stomach. However, GABA as a supplement may be unable to cross the blood-brain barrier. There are, however, many other substances that do cross the blood-brain barrier and increase GABA, such as passion flower, L-theanine, and picamilin. According to some scientists, the use of picamilin in the treatment of neurosis, manic depressive syndrome, and schizophrenia enables lower doses of psychotropic drugs to be prescribed. Combining picamilin with conventional treatments reduces the psychopathological symptoms faster than the conventional treatment alone. Picamillan is a mixture of GABA and niacin. Serotonin can affect sleep, appetite, temperature, sexual behavior, and pain sensation. Since 5-HTP increases the synthesis of serotonin, it's used for several diseases where serotonin is believed to play an important role, including depression, insomnia, obesity, and other conditions. Research suggests schizophrenia may be caused by a change in the level of two neurotransmitters, dopamine and serotonin. Some studies indicate an imbalance between the two may be the basis of the problem. Others have found a change in the body's sensitivity to the neurotransmitters is part of the cause of schizophrenia. Early research suggests that taking 800 milligrams, up to 6 grams of 5-HTP daily with carbidopa for 90 days can improve schizophrenia symptoms in some young men. Acute thiamine deficiency leads to Wernicke encephalopathy. Patients who are diagnosed with schizophrenia are at risk of developing Wernicke's encephalopathy. A timely treatment with high doses of thiamine can adequately treat the Wernicke's encephalopathy. There was one interesting case where a report of a 63-year-old woman with a thiamine deficiency showed auditory hallucinations, a delusion of persecution, catatonic stupor, and catalepsy. Her thiamine concentration was 19 nanograms per milliliter, only slightly less than the reference range of 20 to 50 nanograms. Her psychosis was unresponsive to antipsychotics or electroconvulsive therapy, but it was ameliorated by repetitive intravenous thiamine administration at 100 to 200 milligrams per day. However, 1 month after completing her intravenous treatment, her psychosis reoccurred, even though she was given 150 milligrams of thiamine per day orally, and her blood concentration of thiamine was maintained at far higher than the reference range. Again, intravenous thiamine administration was necessary to ameliorate her symptoms. The present patient indicates the possibility of a thiamine deficiency should be considered in cases of psychosis without neurological disturbance, with high-intensity T2 MRI lesions. Also, this case suggests that a high blood thiamine concentration does not necessarily correspond to sufficient thiamine levels in the brain. Based on this, we must reconsider the importance of a high dose of thiamine administration as a therapy for a thiamine deficiency. Some research suggests a link between low vitamin D levels and a person's risk of developing schizophrenia. A 25-hydroxy vitamin D blood test can assess your levels, and then you can supplement with doses to correct any deficiency. Choline can be found in eggs, however, there's many better supplemental forms. See my video on choline sources for nootropics. Improvement in inhibitory neuronal functions whose deficit is associated with schizophrenia and attention deficit disorder have been observed with choline supplementation. CDP choline is a bioavailable form. Do not use cheap form such as choline bitartrate. Research also suggests that choline supplementation during pregnancy may help to prevent the baby from developing schizophrenia. The importance of omega-3 fatty acids for physical health is now well recognized, and there's increasing evidence that omega-3 fatty acids may also be important to mental health. Omega-3 supplementation is more effective in reducing psychotic symptom severity in young adults or adolescents in the prodromal phase of schizophrenia, who have low omega-3 baseline. Omega-3 supplementation was more effective in patients with low polyunsaturated fatty acid baseline. Doses of omega-3 fish oil containing an EPA-DHA blend can range from 3 to 9 grams per day. A study on 644 bedridden psychotic patients reported a 78.3% of schizophrenic patients had a B12 deficiency. Some studies have clearly indicated the contribution of folic acid and B12 and homocysteine to altered single-carbon metabolism and its role in the psychopathophysiology of schizophrenia. Methylcobalamin is the best oral form of B12. B12 injections would be even better. Note, due to food fortification with folic acid, B12 blood tests are not reliable for detecting a B12 deficiency. Many psychiatric drugs act on the receptors or the transporters of certain neurotransmitters in the brain. However, there's a great need for alternatives, and research is looking at other targets along the brain's metabolic pathways. A lack of glycine, like betaine, contributes to brain pathology in schizophrenia, and new research shows that betaine supplementation can counteract the psychiatric symptoms in mice. Betaine, or trimethylglycine, is now extracted from sugar beets. It's a powerful metal donor with numerous benefits attributed to its use. Psychedelic drugs like PCP and methamphetamine can also produce schizophrenia-like behaviors in both humans and mice. Research has tested whether betaine supplementation could help to alleviate the symptoms induced by the PCP and the methamphetamine. They found that betaine not only improved cognitive deficits and behavioral abnormalities, it also reversed the oxidative stress at the molecular level. Oxidative stress is thought to be one mechanism through which these drugs cause psychiatric symptoms in humans. Investigation of post-mortem human brain samples did indeed show reduced betaine levels in patients with schizophrenia, which was unrelated to the amount of antipsychotic drugs taken before death. They also found a subset of brains with betaine deficit oxidative stress, a pathology that occurred in cases with severe psychotic symptoms. The researchers were able to replicate this pathology in induced pluripotent stem cells that simulate the oxidative stress condition and counteract it then with betaine supplementation. Along with Dr. John Smythes, Humphrey Osmond developed the theory that schizophrenics suffer due to endogenous production of an adrenaline-based hallucinogen. This led the Hoffer-Osmond adrenochrome hypothesis in the early 50s. Hoffer and Osmond, primarily orthomolecular approach to the schizophrenia is niacin or niacinamide in doses greater than 2 grams. In double-blind trials, 3 grams of niacin daily resulted in a doubling in the recovery rate and over a 50% reduction in hospitalization. There are several complexities to niacin therapy. It must be at least 3 grams per day in divided doses. It must not be time-release form made by pharmaceutical companies that are dangerous and the root cause of the irrational fears of niacin. It's most effective if the patient's schizophrenia is fairly recently developed. Ignoring these issues is probably why some studies are negative. Linus Pauling wrote in 1967, "I happened to read a number of papers published by 2 psychiatrists in Saskatchewan, Canada, Dr. Abram Hoffer and Dr. Humphrey Osmond. There was something extraordinary about their work. They were giving very large amounts of niacin to schizophrenic patients, as much as 17,000 milligrams per day, which is 1,000 times the recommended daily allowance. I was astonished that niacin and ascorbate, with the striking physiological property, when given in very small amounts, of preventing death from pellagra and scurvy, should be so lacking in toxicity that 1,000 times the effective daily intake could be taken by a person without harm. This meant that these substances were quite different from drugs, which are usually given to patients in amounts not much smaller than their lethal dose. As schizophrenia can be a very serious illness, and as this information is for research purposes only, make sure to consult a medical doctor before making any change in medication or supplementation. For more detailed information about the herbs, vitamins, or supplements mentioned in this presentation, go to my website.